When considering people incarcerated in jails and prisons, most people focus on the law enforcement and corrections issues, that is, on the crimes and the punishment. But what brought people to the point of committing a crime? And what is life like after incarceration for both the criminal and for our community? The answer to these questions bring us into the area of public health, where we know that the health of a community is impacted by the physical and emotional health of its members, and that the health of individuals is impacted by the well-being of the community. We're going to try to answer these questions on today's episode of A Public Health Journal as we look at the public health aspects of our corrections system. Please stay tuned.
Welcome to A Public Health Journal, a program that explores public health issues facing our society today and tomorrow. The host of the show is Dr. Ed Ellinger, Commissioner of Health for the state of Minnesota. A Public Health Journal is sponsored by the Minnesota Department of Health and the Hennepin County Human Services and Public Health Department, all working together towards the goal of healthy people living in healthy communities.
Welcome to A Public Health Journal. Today we're going to talk about the public health aspects of our corrections system. We will look at the health and behavioral issues that contribute to crime and at the health impacts on individuals and communities upon a criminal's release from prison. We'll also look at some of the health issues of inmates and the services being provided in our correctional facilities. Joining me in this conversation is Tom Roy, Commissioner of the Minnesota Department of Corrections. Prior to being appointed Commissioner, Mr. Roy served as the Executive Director of the Arrowhead Regional Corrections. Tom, welcome to our program.
It's a pleasure to be here and share some thoughtful discussion with you.
Yeah, and it's certainly, the more I've talked with you over the last several years as fellow commissioners, realize there's a lot of public health in the correction system.
There is, and it is a daily concern for us in our department and impacts not only our inmates but citizens upon release as well.
Yeah, and it certainly impacts the public health because people aren't born in prisons. Well, maybe some people are born in correctional facilities, but it's the life before that leads people into a prison. And so let's start talking about, that. What brings people into the correction system in the first place? What are the issues in the community? What are the factors that you have to pay attention to, that I need to pay attention to keep people from getting in there? But what are the factors that you're seeing in the community?
I'm glad you used the plural factors because it is not a singular course of conduct. It is not a singular element in our society that brings people to our attention. It is a combination of upbringing. It's a combination of environment. It is recently become a science. And when I started in corrections 40 years or so ago, a lot of the science around criminology was pretty rudimentary. And over the past 20 years, there's a body of science now that has become parallel to your system in healthcare, where we triage people coming into our system, assess their risk, and look at those risk factors that contribute to crime. And that science has told us a number of things, and there's basically 8 factors or so that are primary to the prediction of future crime, and it leads people to crime initially, and those are antisocial attitudes, a peer group that is oriented towards antisocial attitudes. There are elements of failed education, chemical dependency, family strength is a very important factor. Many of our young offenders come out of dysfunctional families where parenting has not been adequate, or resources in the family have not been adequate to give a good upbringing. And surprisingly, one of the most important factors is that there is an absence of pro-social leisure activities. People that come to us aren't necessarily doing things in the evening hours that are productive or contributing to a positive society. They associate with people that get in trouble and do things recreationally that lead to trouble. And often that is around consumption of substances. And primarily that substance abuse is probably the key factor in our system.
Certainly when we look at the health of individuals, the 2 factors that are the most determinant of health is education, and the other is income. Do you see, is it the same thing with the correction facility? Is level of education correlated at all with whether or not people get into trouble and end up in jails and prisons?
One of the early indicators of future crime and delinquency is school failure. And that could be dropping out or achievement gaps. And many of the disparity that we see in our system is around achievement gap with our minority cultures. And the role of education can't be under-stressed or overstressed. It is key to the future. And if we can keep a kid in school, that'll keep a kid out of prison. That's pretty much our belief.
Yeah, and I know that at the income level, I mean, the higher your income, the more likely you are, because it provides access to care,
Yes.
It provides good food, it provides good opportunity, and actually have some hope for the future. I would suspect that there's some links to that in your world?
Income level is a factor, of course, in culture of poverty, deterioration of neighborhoods and cities, the support of gangs in those neighborhoods, all develop and lead to criminal behavior. That is not to say, however, that there isn't a middle class that also becomes criminally oriented. And in the white-collar crime world, of course, greed contributes to crime, and we have recently seen some very wealthy people engage in very serious crime. So crime is across the spectrum in terms of income, but clearly our prisons are not full of well-resourced people.
Yeah. And I have a little slide here because you had mentioned the mental health issues and chemical dependency. I was really impressed with this number that we've increased our population, but that 90% of all offenders have chemical dependency issues, and 65% of female offenders have mental health issues, and male 25%. And so mental health certainly is a major factor. This is within the prison population, but my guess is then it also is on the outside leading people into the prison system.
Well, we have become the default agency for the end of mental health facilities, the traditional old institutions where significantly mentally ill people were placed in days gone by. With the absence of those facilities now, the jails and prisons have become, and some speculate, the primary source of mentally ill placement in our society, which is a sad comment because our prisons aren't necessarily the best place for mental illness to be dealt with. But we do have a group of significantly mentally ill people who commit significant crimes. The failure of traditional and community resources in that mental health world, especially related to chemical dependency, is, I think, a big equity, public health issue, that these people are not being well served in our community and end up being served in our facilities.
Well, it just speaks to the fact that we do need to be prevention. We need to provide services to people, mental health, physical health, chemical dependency treatment, because it'll keep them out of the prisons, which will save us all money, and it'll actually benefit those individuals.
And keep them out of emergency rooms and accessing emergency services. Many police departments now are expressing great concern about the number of their activities related to mental illness. We have a major initiative in our prisons right now, training staff in crisis intervention, mental intervention, and police are doing similar trainings because on a daily basis we encounter people that have mental breakdown in our facilities. Police experience the same on the streets, and it's not uncommon in downtown areas to see significantly mentally ill people acting out. So this crisis intervention training is prompted by people who say there's a better way to handle these people.
I want to talk about the services that you then provide in the correctional facilities, but first we need to take a little break.
Sure.
We'll be back right after this message.
Oh, those boys are much too much. Those boys We got the spirit. We're hot. We can't be stopped. We got the spirit. We're hot. We can't be stopped. We're going to beat them and bust them.
The smallest moments can have the biggest impact on a child's life.
Let's get a little bit rowdy. R-O-W-D-Y.
Take time to be a dad today. Call or visit fatherhood.gov to learn more.
Welcome back. We're talking about the public health aspects of our correctional system with Commissioner Tom Roy from the Minnesota Department of Corrections. Tom, I want to talk about now what happens in the prisons, but I first want to talk about sort of the demographics of the prison, because I think people don't really recognize that you have a whole age spectrum, you have a whole group of different kinds of folks. And I do have a slide here just talking about one thing that I was really surprised about is that age. You know, that as an aging society, our population is getting older, but also in the prison population, it's an older population. It's in the prison population increased by 0.7%, but the population of offenders 65 and older increased by 63%. So tell us a little bit about the demographics of people in the prisons.
Another twist on that particular statistic from the 2010 census, they recognized that the population 55 and older in this country grew by about 50% in the previous 2 decades. The similar over 55 population in our prisons grew 550% over that same course of time.
Wow.
This get tough on crime philosophy that this country has adopted and has led to us being the most, of the developed countries, we have the most people in prison of any of the developed countries, far exceeding any other country.
And how does Minnesota compare to other states?
We, very fortunately, are second in our incarceration rate using state prisons.
Second highest or second lowest?
Second lowest.
Okay.
And when I say fortunate, we are indeed fortunate because with that comes we are a very low-cost state in terms of our corrections department. As compared to our neighbor next door, Wisconsin, they have very similar demographics to us, and they have 23 prisons. We have about 10,000 people, or shortly we'll have about 10,000 people in our correctional facilities. We have 9 adult facilities. We are second lowest. Our budget for our department is about half of what Wisconsin is because our philosophy is very different in this state. We have sentencing guidelines, and the guidelines that instruct the judges on how to sentence people tell the judges that prisons should be reserved for people with significant criminal histories or are committing crimes against people. Other states have not adopted sentencing guidelines, and hence a lot of people end up in prison that we would normally put on probation, maybe with a short jail sentence. So the people that end up in our facilities either have a significant crime or a significant criminal history. Mm. And that differs greatly from other states. Mm-hmm.
So, even though we have a relatively small number, it's still a good-sized population.
10,000 people.
10,000 people. So you have communities actually. So how do you what's your approach to dealing with large numbers of individuals in a facility in terms of thinking about their health needs?
Sure.
Talk me through what you're thinking about in setting up a system within this community.
Well, the system requires good assessment, and just as you would have a patient walk into a medical clinic, as we have inmates walk into our intake facility at St. Cloud, we do a very comprehensive assessment of mental health needs and physical needs. We do a history of treatment, prior histories. We see what medications they are on. We test for communicable diseases. And within 2 weeks, we have a pretty comprehensive idea of their needs and their course of treatments if it's required. Many of our folks are on medications, psychotropic medications, 60% of our women and about 20% of our men. They have histories of mental illness and previous treatments. And we are cognizant that those treatments have to continue while they're incarcerated. We are required constitutionally to provide reasonable care to them while they are in our care.
You must be the only place where it actually is mandated that a population gets care.
Right, and it was a case, two major cases actually, Estelle v. Gamble in 1976, and recently in California 2 years ago, the Plata case, which required and found that medical care is not optional. And the overcrowding issue on the latest case in California led to about 30,000 inmates being released from California prisons into local facilities because the overcrowding issue was affecting the care that they were receiving for mental health and physical care. So it is a requirement. We incarcerate people because of their crime, and the placement in prison is the punishment, but it's not placement in prison with torture. And if we don't provide reasonable medical care at a community standard, it is not acceptable.
Right, so you must have a whole host of professionals, health professionals, from the physical to the behavioral and mental health as part of your system.
And a significant part of our system. We have about 500 people of our 4,200 people that we hire and have employed in the Department of Corrections are devoted to health care. Dentists, psychologists, case managers, all the support staff for medical records, physicians, and it is a 24/7 operation. And when you have a community of 10,000 people, that community needs attention.
And a high-risk population, too.
A very high-risk population, and a population walking in our door that we have no control over. We don't get to pick and choose who walks in the prison door. And we don't get to choose on the community side of the world, which we have in Minnesota. There's over 100,000 people under community supervision in our community, and they have significant health concerns as well.
Right. I'm going to talk a little bit more about some of the care that's provided and some of the public health services you provide, but we need to take another little break.
Sure.
We'll be back right after this message.
Michael Adams?
Here.
Michael Adams?
Here.
Michael Adams.
Michael Adams.
Students who miss 18 days of school in any grade risk falling behind and not graduating. Absences add up. Keep track at boostattendance.org today.
Welcome back. We're talking about the public health aspects of our correctional system with Tom Roy, Commissioner of the Department of Corrections. Tom, I want to, you talked about the mental health issues that you have in the prisons and the services you provided, and we started the last segment talking about the aging of the population. You must have the same issues within this aging population, like memory loss and long-term care and Alzheimer's. Do you deal with those issues in your correctional facilities?
Well, with the aging population, we have to do that. And in fact, at our Faribault facility, we have a special unit, a geriatric unit, that is a 100-bed unit, and it deals with all those issues. Dementia, we have people with mobility issues, and very senior people in that particular unit, quadriplegics, paraplegics, significant memory loss folks. And one of the challenges we have is, even if we do feel that the placement in a prison is not appropriate at the end of life, we have a very difficult time finding community agencies that will accept our inmates for care. It is not comfortable to have grandma next door in the nursing home with a very significant murderer in the next bed, even though he's 80 years old. So we are challenged in that we've tried to meet that challenge with, first of all, developing our own unit, but we also have medical release planners that triage these cases. They go out into the community and try to find providers that can deal with these issues. And if we put somebody on supervised release or parole that need these services, we offer support. Most of these people that are released do have a supervising officer that is involved with them. There's been lots of attention lately with the sex offender release issue in the Department of Human Services. We have similar issues with placing people with felony convictions. It's a heck of a societal problem right now to have a criminal record in terms of housing, finding a job, finding services. We have not become a kinder society.
And I suspect, what, 90% of the people who go to prison end up back in the community?
Well, surprisingly, I mentioned that 10,000 inmates that we have, almost that entire population turns over every 3 years. So we intake 100 every week or so, and we release about 90 or so every week. So we have this constant change, and that constant change puts people back in the community. And I constantly remind people that when you send people to prison, it's not likely that they're going to stay there for a very long time.
And so you must do a lot of work then with communities, as you're saying, with the elderly and some of these end-of-life things, just on a day-to-day basis. How do you transition people back into actually being productive members of society and safe members of society?
Well, in terms of the mental health issues, in terms of the physical health issues, our medical release planners make sure they leave with the knowledge of where they can get their prescriptions. The funding is set up for future care. We absolutely do our very best in trying to find a home for them or a transitional residence, which is getting to be a challenge these days as well, so that we just don't open the doors and say good luck. And that would be the worst we could possibly do.
Do you know how many prisoners, when released, become homeless?
We have a good number of homeless. The problem is defining homeless, and as you know, it is one of those elusive definitions. We have people in the couch crashers, we call them, that may be staying with a brother or sister and technically homeless. Our weather in Minnesota certainly requires us as a society to make sure, especially in winter months, that they aren't homeless. But we have a good number of people in shelters. We have a good number of people in halfway houses that have not established a residency. And the homeless problem nationwide, especially in the southern states, is significant. And that's a sad comment on our society.
Yeah. One of the things that we didn't talk about when we were talking about what happens in the prison is sort of the prevention activities. I mean, you feed, and people need exercise. How do you build in some of the good nutrition, the good physical activity, the recreational kinds of things that really do support a healthy life?
Well, it's a sweet and sour situation with people in prison in terms of health and the environment. It's a no-smoking environment, which certainly contributes to health. It is a 2,000 to 2,200 calorie a day diet that is reviewed by a dietitian. It's not hotel food, it's survival food, and I would be foolish to...
Healthy food.
It's healthy food. It meets the requirements. Many inmates enhance that diet with our commissary, and the commissary offers goods that are healthy and unfortunately some goods that are not that healthy. We bring people into an environment that is controlled, so we are able to do medication regimes that are enforced, so they can't neglect their medicines. And in mental health, as you know, that is so important that they stay on their meds. The exercise for some of our population is significant. Athletic events, recreation time is important, yard time, and we have gyms, and it is not a health center environment, but they do get active. However, prison also can cause declines in health, and when a person is in the segregation unit for discipline reasons, or in the segregation unit for protection. That solitary confinement does result in some degradation of mental health, and that is receiving a lot of attention nationwide and within our state. It's been an area of attention for me.
And in the last minute that we have, what do you see as the biggest challenge going forward in your world?
I think I am always challenged with the public perception and the demonization of people that have criminal records, and how difficult it is for society to accept people back from their prison experience to become reintegrated into society. The internet has created an environment that employers, landlords, community members now know who's living next door. And it's very, very difficult for our offenders to reintegrate and find a life with hope.
Yeah. Well, Tom, this has been fascinating. We just scratched the surface. Obviously, you're a great public health partner, and we need to continue to work on what brings people into prisons, what happens in prison, and what happens when they get back into the community. It is all part of what we need to do here in Minnesota. So thanks for the work that you're doing, and thanks for being on the show.
And thank you for your work. Much appreciated, and you are certainly adding to the lexicon of public health here.
Good. All right, and I'll be back with a closing comment right after this message.
College is hard. Down. Those books are heavy.
My sport is football, but my passion is education. So every year I take promising high schoolers on a college tour to show them that higher education means a brighter future.
My name is Nnamdi Asamoah. I don't just wear the shirt, I live it.
You can be a reader, tutor, or mentor too. Take the pledge at liveunited.org/volunteer.
Do you wear this?
Personal choices have a powerful influence on one's health and overall well-being. While these choices are personal, they are made in the broader social context that either supports or undermines them. Individuals need to be held accountable for the choices that they make, but our job as members of the broader community is to create an environment that helps make the healthy choice the easy choice. We know that a good education, employment, secure housing, and good health increases the chances that an individual will be successful in life. When any or all of these factors are missing, it is difficult to maintain an optimistic view of life and more likely that an individual will make bad life choices. That's why the best crime prevention strategies are helping people get a good education, creating well-paying jobs, secure, stable housing, and providing good mental and physical health care. These are also the strategies required to keep people from returning to a life of crime after they have served time. It's never too late to focus on prevention. That's all for today. Thanks for watching. I hope you can join us again next time on A Public Health Journal.